Well, thanks, Leila. And men have been encouraged to live a healthy lifestyle to improve the quality of their sperm production. This comes as it is estimated that at least 4.2 million Kenyans require medical assistance to conceive. On the other hand, experts believe that the quality of sperm in men has significantly changed, as the younger generation is now testing for low sperm count or no sperm at all.
Raising a family is something a lot of people look forward to, but it's never guaranteed or as easy as it seems. Infertility sometimes stands in the way of many couples' dreams to sire children. When this happens, the blame is often shifted to the woman, despite the fact that men too suffer infertility.
And you find that, not surprisingly, that men are in denial. They don't accept it very easily. It's like you hit a man's ego to the highest, But a few do come forward and accept, the options which are available to rectify the situation.
In context to Kenya, we have done almost 2,000 Kenyan men with, and almost more than one third of reason for infertility is because of the male factor. So the count is low, either the motility is low.
According to the World Health Organization, infertility is defined as the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. It is estimated that 48 million couples globally and 186 million individuals live with infertility. In Kenya, about 4.2 million people require medical assistance to be able to conceive. On average, the normal sperm count ranges from 15 million to greater than 200 million sperms per milliliter of semen. One is considered to have low sperm count if they have less than 15 million sperms per milliliter or less than 39 million sperms total per ejaculate. And the dynamics are now shifting with the ever-changing dietary needs as younger men increasingly suffer infertility.
So most of them are from 30 years to 60 years. I mean, even men at 60 comes here for parenthood. So there is an established fact that men after 45, the quality of sperm declines because of the DNA fragmentation of the sperm. That is age-related. But even those who are young, their sperm count are low or very low. The motility is bad, the morphology is bad, and most of them are obese.
According to the World Health Organization, low sperm count in men is often attributed to environmental and lifestyle habits such as smoking, excessive drinking, overexposure to toxic pollutants, obesity, or obstruction of the reproductive tract, infections causing dysfunction in the ejection of semen.
It's been known that people are exposed to industrial chemicals, pesticides and the rest. They actually reduce sperm count. It's also been known that heavy metal exposure like lead, there are people work in those industries, that really affects sperm count, or exposure to radiations or X-rays. The other one which is interesting is the overheating of the testes. So that would affect about people who are doing border riding, so you find studies have been done which have shown that anybody who exposes the testes to high temperature, that's border riding, long distance truck drivers, or if you just sit for long with tight clothing, it's been known that that environmental factor can actually reduce sperm count.
Furthermore, infertility could be attributed to genetics in various occurrences, as it could be transferable from father to son. On the other hand, there are now various treatments in place to address the issues at hand, such as treatment of infections in the reproductive tract, assisted reproductive technology, and hormonal treatments where infertility is brought about by increased hormonal levels. However, the lack of a legislative framework to address assisted reproduction is seen as a challenge for couples seeking fertility treatments. Helen Aura, NTV.
All right. Thank you very much, Helen. Of course, that forms the subject of our conversation today, and that is on male infertility. And like I said earlier on, this is one topic that we'd rather not talk about, or even if it's talked about, it's more in hush-hush tones. But again, from the report, a lot of people are struggling with the same, and that is as far as infertility is concerned. And also we're seeing a rise, especially when it comes to the men. So what's going on? What's not happening? And of course, what they need to do to make sure that we're all healthy, number one, both male and female, so that again, conceiving naturally happens. All right, so of course that is what we want to understand today. So many questions, and of course we'll be seeking answers to the same, but we're also asking you a question. All right, and this is specifically for the men. All right, so men, the question that we're asking you today is, how often do you go for fertility checkup? Once again, how often do you go for fertility checkup, or just really checkup in general? All right, how often do you do it? Feel free to interact with us on our socials. On Twitter, it's at NTV Kenya, at Lubembe_Winnie. Remember, the hashtag to use is your world. But if you want to chime in via Facebook, again, it's okay. You can do so. And that is on NTV Kenya. But if you want to call in live, if you have any question, any clarification that you're seeking, or you also want to share your experience with us, then feel free to do so. The numbers are down on your screen. But at the end of the questions, but most importantly, learn how we can deal with cases of stigma when it comes to infertility. So it's going to be an amazing conversation. I look forward to what you have to say as far as the question that we're asking you, and that is for the men. How often do you go for fertility checks? Again, interact with us. I'll be looking at your feedback as we continue with the discussion. But right about now in studio, I have Dr. Wanjiru Ndegwa Njuguna, who is a fertility specialist. It's so good to see you once again. Dr. How are you doing this morning?
Very well, Winnie.
Had to wake up pretty early, huh?
Yes. No, not really.
Not
this
really,
is for us. We wake up this early most times. Yes.
Right. Okay. Yeah. Thank you very much for making time for us. This morning. Really appreciate it. And of course, we'll also be joined by Dr. Samson Misango, who is a urologist. But we also have Francis on the line. No, David. We have David on the line. We'll be joined by Francis a little bit later. So, David, good morning. Can you hear me?
Yeah, I could hear.
David, are you there? Habari asubuhi. Salama sana. Thank you very much for agreeing to just speak with us as well, as far as, infertility is concerned, because like we said, there's a lot of stigma, surrounding. Before I come to you, Dr. Wanjiru, let's just understand infertility in men, because most of the time it's usually infertility in women that is, mostly highlighted. But in men, what does it look like?
Well, I'm happy to be on this show because I think it's a subject, as you said, that is really taboo. Nobody wants to speak about it, but it does need to be highlighted. People have always said that it's the woman's problem, but in effect, infertility is equal. If we look at the statistics, 30% of women will have a problem, 30% of men will have a problem, and 30% where both the male and the female couple will have a problem. And then in 10%, most of the time, we have no idea what's the unexplained fertility. So male fertility is a contributing factor, probably 50 to 50%. What it looks like is really, most of the time, it's a semen analysis that will tell us that you have a male factor problem. So the couple usually come, they haven't conceived for a year or 2 years or 3 years. And we do a semen analysis, and it tells us everything that we really need to know.
And there's a term that you usually like to use, and that is subfertility. So every time I'm talking to you, I'm like, subfertility, remember. So there's subfertility and infertility. What exactly do you mean by subfertility?
So infertility, of course, is that there is no possible way of getting a child in terms of you have no gonads, so no sperm, and for the woman probably she has no ova or the very poor quality ova. So that's infertility. It will not happen. But when we say subfertility, it is that you have a possibility. You probably just need to do some forms of treatment or something else to help you get pregnant. But it's not an absolute.
And how then do you categorize an aspect of subfertility? Because I can understand, especially as a couple, you're married or not, still okay, right? Sometimes people are really either too quick to judge, hey, maybe I could have a problem or maybe not. So at that you look at when it comes to subfertility?
So we feel that after 1 year of living together, because there are also couples who do not live together,
sure.
but 1 year of consensual, of course, intercourse about 3 times a week, that has been happening for 1 year and you are not getting pregnant, then we say you probably have an issue, a subfertility issue. You need to be seen. Of course, the tests then tell us whether it's really that you have infertility and will not be able, or if something can be done.
All right. And Dr. Misango is with us finally. Hi.
Good morning.
Good morning. It's good to see you once again. Karibu sana.
Asante sana.
The question that we're asking the males today is how often do they go for fertility checks, right? So you are a urologist. Of course, you deal with men most of the time. The question on infertility in men, and of course we said this when we started the show, it's usually like hush. We don't really want to talk about it. The men themselves would not want to talk about it because, again, a lot of stigma and all those things. So from your perspective, what does it look like when a man comes to you and says, hey, daktari, ni kama kuna shida?
Once more, good morning, viewers. Now, you've rightly put it. Infertility is a very tricky subject in men. Because from the way I put it, from time immemorial, men have been recognized as the people that are supposed to provide the seed for procreation. And if a man is not able to provide that seed for whatever reason, then he ends up, and he will go through a lot before he actually comes to seek help. Because society judges men very harshly for being unable to produce that seed. And so they will go around, they will beat around the bush, they will sometimes even ask people to help them before they come to a doctor. However, things are changing because I think in the current world that we're living in, men have realized that the more you talk about your problems, the easier it is to solve them.
Okay.
So it's not like the way it was maybe 10 years ago. And I think I can attribute that also to the fact that they are present.
Okay.
So more and more men are actually coming. And it's still a very tricky subject for men.
Yeah.
As opposed to women who are a bit more in touch with their emotions. Men regard this issue as judgment on their failure. Yes.
Okay. And I'm pretty sure you've had a lot of men say, "Ai, wanaume anashindwa aje." You know, like it's given that they have the seeds, but clearly there's a problem. But I'm happy that you're saying, you know what, we're seeing a lot of more men who are coming, just to seek to understand what's going on. I'll come back to you, Dr. Misango, but let me speak to David, who joins us via phone. So David, once again, asante sana for, just accepting, first of all, to speak with us about your experience. So when exactly did it happen? Like, what exactly happened? Because what I understand is, of course, your girlfriend left you, went for another man and got pregnant, right? So when was that? What exactly happened that, ukadecide wacha nidi nikatafute usaidizi?
Unajua, now I'm 32 years old. Na kwa hii 30 years nimeenda, unajua unaanza pale kujua mambo mengi kwa like 22, 23 years, unajua. Naanza kujua mambo hapo kwa 22, 23. So kuna watu unakuwa na marafiki wa kike unakuwa nao mara mingi. Kisha kwa nao unajua sometimes mambo yanahappen, nafika mahali nasema hata nikae tu, nikae na mtu fulani. Unakaa naye, unajua ukianza kukaa hivi people expect utafanyika hata wewe mwenyewe una expect, unaona. So unakaa aje kunaendaje, ama kuna dunga imewekewa dunga, inaenda hivyo hadi mnaulizana. So inafika mahali unajua sometimes kidogo watu wakiingia kwa nini like marriage, bit mob inakuanga like stress, lakini inafika mahali hii inaisha ladha. So unaanza ni kama shida inaanza kutokea nini kwa zinaanza kwa pia ni kama story ya mtoi, hakuna nini. Alafu unajua ukiwa una mtoi na mtu kwa sana very easy. So 1 year fanye na kitu. Hapana, mimi siwezi lisha mtu pia, labda amenipea dunga. Umeona, pia na anaanza kulalamika. Inaenda hivyo anaishia. So anaenda mahali pengine, anakaa huko, unapata ashapata mtoi. Unasema ni sawa watu wachaishi. So unakaa ikiti someone else. Unakaa naye, unapata the problem hiyo, watu waiji yako ndio wanaishia makazi wako wanaenda. Hapana, inafika mahali unaweza kujiuliza hapana. Shida iko wapi? Hata watu wanaanza kucheka mtaani. Mtu amekuja juzi amekaa na mtu wake, ndio ameshapata mtoi. Wewe uko tu pale. So, ikafika nimeenda miaka mingi kuanzia 2023 kwenda hivyo. So, niko na relative wangu. Relative wangu unajua pia, unajua kusoma pia ni poa. Kwa hujasoma hizo kujua mambo mob. So, age wanajua mambo mob. Akaniambia hapana, juu tunaka age range. Ndio alianza kunieleza story. Hiyo. Infertility ndio anaweza saidia msemo. Hapo ndio nisikia.
Okay. So kabla tuendelee, umesema ilianza ukiwa 23?
Yeah, huko ndio nilianza kukua. Hello?
Nakusikia?
Hapo sasa ndio nilianza kujua mambo ya wasichana, nikaanza kwani like nafanya kidogo ndio naanza kuisha again. Yeah.
Okay. So David, please stay with us on the line. I want to throw this to you, Dr. Wanjiru, because listening to him at 23 is when he was introduced into, girls, women, intercourse, right? And then tried over time at 32 is when he tried to have a baby, but, it didn't happen. And you see, listening to him, you might think, lakini you're too young, which is one of the things that people would always talk about. You're too young, what exactly can happen? Could you just help us understand what might be happening here?
I think for males, you see there is no sign.
Yeah.
Unfortunately, I have a lot of, I've had patients come and say, but I have a sexual function, I have a proper libido, I am able to get an erection, I'm able to ejaculate, and it's of course a good amount, but why am I not getting pregnant? Unfortunately, this does not mean that there are actually sperm in the ejaculate.
All right.
So that's something we need to remember, that just because there is an ejaculate, it doesn't mean there's sperm, and it doesn't mean that the sperm are adequate in numbers or are normal in morphology, in the way they look, or they're moving at the right pace of movement to actually cause fertilization to occur.
Okay.
So this is the problem with men, that it could be very silent and you think everything is okay.
Yes.
And that there's no problem because it's nothing that you can really see. Yeah, so I think, it's not something you can see. That's the point that I would want to make with that.
And does it make it then difficult for so many men, and especially around his age, where they'll be like, but I'm young, but I have all the energy, I have everything basically that is needed to get someone pregnant, and it is not happening. Is this one of the things that you would say it's a problem? Is age a big thing that people should start looking into?
Let me put it this way, in a way that people can understand. You see, I said at the beginning that men are seeds, and in that way I can equate a woman to be a shamba.
Okay.
And this man must find a way of putting that seed into the woman, and then factors have to be okay for that seed to germinate.
All right.
Now, sometimes a seed might be present, but it's faulty. Sometimes a man might have seeds, but does not have a good jembe to dig the shamba.
All right.
Sometimes a man might not be having, the seed might not be there at all. And as Dr. has well put it, you see, in infertility, there are various factors involved.
Okay.
You brought about the question of subfertility and infertility. I would easily put it this way. Subfertility is when a couple has difficulties in getting children,
Right.
where infertility is inability to get children. So, there could be so many things wrong in a man's side. I'm sure Dr. can talk about the women's side. But from a man's point of view, there's a problem with, number one, there could be a problem with production. Number 2, a problem with concentration or optimizing of whatever has been produced. And number 3, delivery into the garden. Now, for some men, it's possible that you have been born with a faulty production system.
All right.
Which means either the testes are not able to function the way they're supposed to function in terms of production of the seed. In other characteristics, the man is normal,
Okay.
which means he has the hormones in place, but the seed is having a problem. In sometimes it could be the hormones which he has been born with that are a problem. He has the seeds, but they are not optimized. In some cases, he could have been born with things that are all normal, but he had an injury which he was not aware of. He had an infection which he was not aware of. He actually is able to have a normal sexual relationship, but what is being produced is not a seed that can fertilize.
All right.
So it's a complex interplay of so many things. What he feels, what he can do, and what the woman can be able to receive.
Okay.
So it's actually a complex thing, and for most men, in fact for some children, they actually start having sexual activity earlier than their peers because of some hormone imbalance in their system. We like talking about women as being hormonal, but men are also hormonal.
They're hormonal as well, true.
And that is one of the things that actually can cause a problem. So some men can actually have early sexual development because of a problem with their hormone production system that ends up making them infertile at a young age. So there's so many things that happen, but you will never know. We should say a man can never know that he is infertile until the moment of truth when he begins planting. And then there's no germination.
That's true. That's true. And I can imagine the effects that it might have, because this person grows up knowing they're okay, they're absolutely fine. But then again, when it comes to we're ready to have kids, is where they find out that there's a bit of a problem. And of course, you say it's a bit complex, but we're here today to just make it easier for people to understand, because a lot of men are actually suffering most of the time in silence, because again, there's a lot of stigma that surrounds the same. So we've talked about an aspect of the count. First of all, it has to be enough, right? So the question is, what is enough? What's normal, what's not?
Yeah, well, I like to say that, well, I won't say it here, but I like to say men have a lot of sperm.
Yeah.
So when the normal WHO finding is that we need 40 million sperm in a sample. Okay. And an adequate sample is usually 1.5 mLs of ejaculate. That will give us an accurate number that if we find 40 million and above, it's okay.
All right.
But we have found 600 million sperm. It's a very varying number. But over 40 million, you will be able to conceive naturally. Okay. So that's for natural conception.
See, the question always is 40 million, why? And yet you only need one. That one, to fertilize an egg.
Yeah. As he said, it's a complex journey for sperm. I mean, the complex, the environment that they have to go through to get to the fallopian tube of the female, which is where conception occurs, or fertilization actually occurs, is very tortuous. It's long. It has also a lot of things that will deter the sperm on the way. It's really, you need numbers. You also need speed, and you need a normal sperm that has a head, a body, and a tail that is moving at a certain speed to actually reach the ovum. It's really complex.
Yeah. We want to understand. We really want to understand more, but of course, all that will be coming up after the break, where we'll be looking more on then the morphology, like you talked about, the motility, as well as the volume, which you said is what, like 40 million is okay.
Yes.
All right. Okay, so we'll still have a lot of questions on this, even especially the aspect of you only need one. Why do you need to have like as many as possible? But again, you need to have options because, like you said, it's a long journey by the time fertilization occurs. Okay, so let's take a break. But remember the question that we're asking you today, and that is for the men. How often then do you actually go for fertility checks? Once again, men, how often do you go for fertility checks? That is what we want to understand. So keep tweeting at NTV Kenya, at Lubembe_Winnie on Twitter. Remember to hashtag your world. But if you want to join us via Facebook, it's okay at NTV Kenya. All right. But before we go on a break, a campaign that you need to know. And that is children all around Kenya rely on water from unsafe sources. So Colgate is asking you to help change this. And just a little water can make a big difference. For every pack of Colgate that you buy exclusively at Naivas, you help us build 30 water wells that will provide clean water for 120,000 Kenyans. So give a helping hand and shop at your nearest Naivas store or online at naivas.co.ke. For more information about the campaign, go to Colgate Kenya's Facebook page or wellboring/colgate.com. Once again, terms and conditions apply. See you after this short break. This is your world. Yes.
Misango has achieved tremendous growth ranging from increased membership, asset base, excellent liquidity, and wide range of awards from various sectors. Visit our head office in Mombasa or our marketing offices in Nairobi, Kisumu, and Voi. Join the award-winning circle today and realize your dream.
Guys, lipstick is for mommy, not the wall. I said pick one each, one. Children, they are cute no matter what they do, but there is nothing cute about fever. Panadol Baby and Infant starts to work on fever in just 15 minutes. Trust Panadol Baby and Infant to work on fever fast, to bring back their cute smiles.
New Even and Mad Dog Spot Corrector. The power vitamin C. Bye-bye dog spots.
Wajua mtu akitaka kukana, hiyo ndo ishara kuu ya mapenzi ya kweli. Upo
endelea hivyo, tuone Richard atafanya nini akijua si eti anakupenda, ni juju umekuwa ukimwekea.
Nami nitamwambia Sera.
Na smile hata kidogo.
What is there to be smiled at?
What do I have to lose?
Huyu hapa ni Aisha, mchumba wangu, sio mjakazi wangu. Kwa hivyo kila chote ambacho atakwambia utafanya. Nimesema nini?
Nimpatie heshima yake.
Heshima zake. Lakini ni sawa tu.
Get peace of mind and protect the ones you love with the power of Dettol Bar Soap. It cleans and protects from up to 100 illness-causing germs. So no matter what type of mum you are, trust Dettol.
You're watching Your World in association with Colgate.
Welcome back. Glad you're still with us. The show is Your World, and just in case you're tuning in now, today it's all about infertility in men. And of course, it's a very important conversation to have, in as much as there's a lot of stigma and taboo surrounding the same, and yet so many people are actually suffering in silence. So we're giving you all the info you need to have, so that the next time you hear someone talk about infertility, we don't feel shy, or we don't feel we're here, but we try as much as possible and help them seek help, okay? And just reduce cases of taboo and stigma as far as infertility is concerned, both in men and women. But today our special focus is on men. So the question that we asked you is, for the men, how often do you go for fertility checks? That is the question that we're asking you today. Let's get to hear what some of you had to say. So Okira Jesse says, why? African men are born blessed to fill the world. Okay. All right. And then Governor Mukina says, I just eat mokombero and now I'm good. Okay. All right. And then someone else says, this is Jairus Barongo Onchueri says, this is a European problem. All Kenyans are fertile. Okay. All right. Jairus. All right. And then Moni Solomon says, fertility test is practical with undeniable results for everyone to see. Get a woman pregnant and the world will pronounce you fertile. Okay, so Dr. Onjuru and Dr. Misango, what do you make of this? What do you make of what people are saying? Dr. Misango, let me start with you.
To a certain extent, this is what society expects.
Yeah.
Because a man is expected to be a man, complete man at birth.
All right.
And that's why when somebody is born, once the doctor declares, it's a boy,
yeah,
the society has some way of celebrating.
Yes.
And when the society declares it's a boy, it's a girl,
yes,
they celebrate in a different way.
Yes.
The gentleman who said that a man is born to fill the world, I will take it back to the analogy of the seeds. You see, seeds are there to basically germinate. And it is expected that every man is a tool that should be able to implant that seed. I will just flash back a bit to the conversation you had about why so many seeds are required. It's just like in that analogy. When you are planting in a farm, you will require many seeds because along the way, some of them will die, some of them will germinate. Sometimes the environment around the seed, which is the woman, might not be very conducive. Some land might be barren, some land might be fertile, some environment might not be very conducive.
All right.
So all these things come into play, and that's why the law of probability provides for more seeds so that at least one of them can grow and be able to fertilize. Yeah. Somebody else mentioned the use of mokombero. I think I need to clarify here that infertility and potency are two different things.
All right.
A person needs to be potent, in other words, not to have erectile dysfunction, to be able to deposit. That is what I call now the djembe being able to till the land, to plant the seed. However, infertility is not equals to impotence. So somebody might be very, 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 very vigorous sexually, but they are firing blanks, so to speak.
Okay.
Okay? And that is one of the things that we usually say we need to warn our people about. Does everybody need to go for fertility tests? I don't really think so. Because not everybody will produce children, as much as that might be the desired effect of life. So it's only when somebody is having difficulties in getting children that they can go for the fertility test. Because even if you go for fertility tests earlier on in life, and it's not your intention to conceive during that year, it's an exercise in futility.
All right.
Because things change. It's like measuring the quality of the soil or the quality of the seeds in one particular planting season, and you don't plant that year. The following year, the environment has changed.
Might change. Okay.
So routine fertility tests, I don't advocate for them, but it is important when you're having difficulties in conception or inability to conceive. She mentioned that normally WHO gives about 1 year, but for older couples, we say as long as you feel that you are having difficulties, even if it's 3 months or 4 months, then the earlier you seek intervention, the better.
Go and see.
Yes.
Okay, I want to hear what Dr. Ndegwa says, as far as just fertility checks. Again, like, wouldn't you rather know earlier, because like we said earlier on, there's some men who maybe were born that way with some, some bit of issues here and there. So wouldn't it be better to know earlier, maybe start treatment earlier? I don't know. What do you have to say?
Yeah, I really do feel that it's an individualized check to take. As you said, there are congenital issues that or things that you can notice at birth. So if a child is born with undescended testis, and that has been picked up, and some people don't know, to be honest, that their testis was not descended into the scrotum, because at birth they should have come down in utero or in the womb. A male's testis is in the abdomen, and then when they're about to be delivered, they come down. So if the testes have not descended, and some people have no idea, even at 40 they'll come with undescended and had no idea.
That's true.
But if you did know there was a problem, you should get a check actually, and even before marriage, I think it's good for a man to have been checked if he had a prior problem.
Okay.
There are other problems like trauma. Suppose you're a rugby player, you're a football player, you had some trauma in that area as you were playing, you had a bicycle accident, you had any surgical intervention, you should actually get a test before marriage or earlier in the marriage if there were, things that could show that there is a problem. So such sort of men, we say, come earlier. If you've been struggling to conceive, or you've not had a conception in a year and you've been with somebody, it's also it's good to check, I think, because there may be something wrong that could be corrected, by the way.
That's true.
If you come later, we wouldn't be able to correct.
Absolutely.
So I think it is important.
It's important, and like we said, it's a very individual journey.
Yes.
Now, there's something that someone said from the feedback, and they said, African men are born fertile. Right? I really want to hear what you have to say to that before I got to David and Francis, who are joining us via phone.
This is the conception. I mean, this is what people believe, that if you're a man and you have a beard, you have the shoulders, I mean, there's no way. There's no way
you would not be able to.
Which is really not true. We have men who have everything, but their testosterone levels are low, they have no sperm, they have something we call azoospermia. So it is not true. Okay. And if you want me to take you back to what we were talking at the break, is that of course we have 40 million sperm that are normal, but it's important to know that usually only 4 to 24% of these sperm are actually normal in the way they look.
Wow.
Yeah. So if we say 4%, which is the strict criteria to say you're fertile, that's 1.6 million sperm that are actually normal and can cause a conception. Whereas the woman has one egg and ovulates and we conceive. And so I guess also there's some inefficiency in the male sperm production.
Okay, all right. And I'll come back to talk about then the abnormal. What does it look like? Because earlier on, like we talked about an aspect of ejaculation. And I think we see this with a lot of men who say, but I ejaculate, then what do you mean that I am not able to, So it's a lot. And then we'll also talk about some medical conditions as well that might lead to a case of infertility. But let me talk to David. So David, like you said, you're 32. You had a girlfriend for a year, tried to conceive, but it did not happen. And then, that ended. And then you also got another one. But again, it did not happen. And you said you had someone who, talked to you about, hey, how about let's try and seek medical attention, right? David, if you can hear me. Yes. Yeah. So at what point then did you decide, and even before, you decided to come to Nairobi and seek help, ulijaribu like any other form of treatment just to make sure that you're okay?
Hapana. Jaribu, niliambiwa na rafiki wangu hivyo. Then akanichukua akanipeleka hivyo. Hapo ndo alianza kujua ilikuwa.
Okay.
Issue because waliniuliza mambo mob. Tunajua mimi ni mtu ni group haiko fit hivyo sana. So hizi vitu tulikuwa tunatumia pombe. Mimi niweza kunywa pombe nikiwa mdogo local brew. So vitu mingi tutumia tu drugs nini. So hapo ndo walikuja kuniambia issue yangu iko pale.
Okay.
Kwa drugs ndipo nianza kujika nikiwa mdogo nini. So ndio akaniambia nilingane na hizo mavitu.
Okay, so uliambiwa mostly ni alcohol, drugs ndo imekuwa ngumu for you to conceive, yeah?
Yeah.
Okay, so but what exactly? Uliambiwa, is it the number that was low, ama the quality was not good?
Wale waliniambia number haiko enough.
Oh, number haiko enough.
It's enough.
Okay, all right. Okay. Sawa. Thanks, David. Stay with us. I'll come back to you. But let's talk to Francis. Francis, good morning. Thank you very much for speaking to us this morning. If you can hear me, you always champion for men to just go and get tested. So my question for you is, have you ever gone for a test, and why do you feel it is very, very important for men to just go and get checked?
Good morning. I hope you can hear me.
Yes, we can hear you. Yeah.
Fantastic. So I think on my side of the story is in quotes a bit lucky, because fertility is more of an elimination process. First we go, you're not getting a child, so what's wrong? And there's a whole list of things to check. First, let's check the lady, is she ovulating? Yes. Then, or no, she's not. Okay, can we make her ovulate? Okay, yes, we make her ovulate. And then, so eventually it came to my turn. Like, okay, so we fixed your wife, in quotes, sort of fixed her. But now, are you producing good stuff?
Okay.
So it reached a point where I was being the supportive husband, telling her, okay, yeah, we can do this. Yeah, you can go for the test. You know, you can do this. You can take this medication. And then all of a sudden, I'm told, okay, now it's your turn. And I'm like, but I'm a man. I'm okay. I'm a guy. I'll be fine. And they're like, no. It is a process of elimination. Just the same way we did with her, we have to eliminate that this is not a problem. And therefore, we can only, because everything that is a problem needs to be treated and addressed. So how do we do that?
All right.
So eventually, I had to go to the test. It was a bit scary, it was a bit embarrassing, but I was, well, I don't know if you can put it in luck, but yes, my results came out and I had a normal sperm count. But even just the whole idea that perhaps I'm the problem, the whole mental anguish that a man can go through just thinking, no, me, I'm not the problem. And I think a lot of people who go through the fertility process get stuck right there. We've gone, the lady's willing to do all her tests, the lady's willing to, go through all these different treatments, and then they turn and say, na wewe?
Yes.
Alafu sasa we start scratching our heads. No, niko sawa.
Yes.
And that's usually where the process gets stuck. When it breaks, the lady doesn't understand, so it also breaks her. Like, I've been doing all this. I've been going through years of treatment, years of medication, years of hormonal adjustments. Why can't you just take this one test? And the man is just like, no, niko sawa.
It's the denial part. Okay. All right. So you said for you, it was a very scary process. But my question is, I want to take you back. Because like you said, it's a journey of elimination, right? So is it that you were trying to conceive, or what exactly happened that you found, at a clinic?
Yes, yes. So we got married and we wanted to conceive, and it was not happening.
All right.
And so we went to see a specialist.
All right.
Seeing the specialist, we ended up going through a series of tests. Of course, first we started with my wife, because immediate assumption was that maybe it's her. So we went through those steps, and then eventually Dr. Wanjiru turns and tells me, "What about you?" And I was a bit shocked.
Yeah.
Like, what do you? But we were trying to conceive, and after 5 years of treatment, we were successful.
5 years of treatment. All right. I'll come back to you to understand for the 5 years, what were the treatment options for you and the journey, but also something very quickly that you mentioned is it's a very scary process and an embarrassing process at the same time. Why the embarrassment? Why did you feel a little bit embarrassed?
So it's number one, you go into a lab, a new environment, and you're asked to give a sperm sample. Now, unfortunately, there's only one way of getting a sperm sample, and it's not it's not a socially acceptable, manner. So the fact that you have this cup walking into a room and everybody is there, when you think that everybody, the nurses, the doctors, the receptionists, all know that this guy is going into that room to try and ejaculate and get a sperm sample. It is quite embarrassing, and it's not a comfortable situation. I mean, I think it would probably be easier if they give the cup and they told you bring it back tomorrow. But unfortunately, it happens in the lab. So this is something. It is a harsh reality. For a man, you must embrace that, and you must just eliminate it from the whole tick boxing, because everybody has to play their part, literally.
I hear you. I'll come back to you, Francis and David, as well. So please stay with us on the line. And Dr. Wanjiru, very quickly, and especially for David's case, it was more of the amount was not enough because, again, like he said, there's a lot of alcohol and drugs and all those things. And probably one is watching us and thinking, how does that affect, especially the number that is required, to fertilize an egg?
Yeah, I think, excuse me, at the starting of the show, we said that the number of people coming in with poor quality or lower sperm or male fertility is on the rise.
Sure.
And it is actually true.
Yeah.
And one of the reasons is the alcohol, is the smoking, is the marijuana, all these drugs. And the reason is they are toxins. And what toxins do is that they affect the process of growth of cells that grow very fast. And one of the cells that grow very fast are the sperm cells. Yeah. So such toxins will affect the production. Okay. They will affect the way the sperms look. And they will affect, of course, the way they move. So they affect all aspects of the sperm quality.
All right.
So if you had 40 million and you heavily smoke, you heavily drink, you use all these other toxins, or toxic substances, they will reduce the number maybe from 40, and sometimes you can get 5 million, 300,000. I mean, it's,
Okay. So is it more on the duration of time? Because I've had someone say, but me, my grandpa used to drink, drink themselves silly. My dad used to, but they had like 13, 14, 15 children, right? Yeah. So is it what you take? Is it the duration of time, or is it the amount?
I think it's all.
All of the above.
It's all of the above.
Okay.
Duration, of course, but I also think people are starting to take alcohol a lot earlier than, those people in... Sure. And also those, earlier people used to eat right foods. They were all... If you're eating food from the garden that doesn't have any chemicals and pesticides, that doesn't have... and fresh green leafy vegetables, fruits, those are things that help with the antioxidant properties. Basically, they work against these toxins. So I think the diet was different. They also would walk to... We have a sedentary lifestyle, so we are more obese, we are unhealthy. So there's a lot of factors that are coming into play in terms of environmental factors for us right now.
Yeah. And can we just address that deeply in terms of the different environmental factors that might lead to the same, and then we'll come back to, like the medical aspect of it that might lead to a case of infertility. Let's focus on environmental and mostly lifestyle, because again, like we said right now, and especially younger people, initially it used to be like an age thing where the older you get, the more, but now we're also seeing in younger men who are having issues as far as, fertility is concerned.
Yes. I just to add on to what Dr. has said, first of all, let me compliment the two patients, David and Francis. These are brave people, because it's very, very, very rare that men come on in public and talk about their fertility issues. So thank you very much, because that improves the quality of our discussion. Now, among the things that will cause men to have infertility issues, as you said, it's a myriad of problems. And we cannot pick on one particular thing and say this one will definitely cause a problem. But you asked specifically about the environment and the diet, I think. Yes, we do know, as Dr. has said, you see, every living person is made up of cells. These are alive, they require blood, they require nutrition, which comes in blood, for their well-being. Anything that affects that microenvironment will interfere with the production and development. And we talk about lifestyle being composed of healthy living. From the time we're in primary school, we were told about have a balanced diet, have fruits. These things are kind of, people ignore them. Alcohol, of course, excessive drinking of alcohol will interfere, because these are toxins. The liver has to work on them to basically break them down. As the liver gets tired, it also begins affecting other hormones in the body which are being produced. Smoking is a well-known substance that interferes with blood flow. The conditions like diabetes, hypertension, all illnesses, any illness that a person has that has been there for some time, it causes some stress on the body. Any stress of a particular, for whatever reason, stressful situations interfere with hormones in the body, and is an interplay between blood flow, hormones, well-being, and the cells. So anything can actually cause a problem. We also have, as Dr. said, about people who have an injury, or maybe some investigation that were done, or some interventions for medical illnesses, and somebody is getting medications. So anything can actually interfere. So there is a complex interplay of so many factors. One of the, I think it was Francis who mentioned about, oh no, I think it was David, who talked about drug abuse for some time. So these are all factors that have been known to cause a problem. Does it mean that things will be reversed when it stops that? Nobody can say for sure. But any improvement in your health, in your lifestyle during your development years will contribute to good quality sperms. So it is an interplay of so many environmental factors, and also how active you are. A lot of infertility or subfertility in men is associated with obesity. People who sit, you basically add weight. That weight is an environment that converts the testosterone that a man produces into a female hormone called estradiol and estrogens, which a man will need. But in excessive amounts, it now interferes with the quality of the sperms of a man. So there's a whole interplay of environmental factors, diet, lifestyle. Yes.
All right, and it's important that we're talking about it so that people know. All right, and Dr. Ndegwa, very quickly, in terms of the medical factors that might lead to a case of infertility. Of course, we talk about undescended testes as well, but what are some of the other medical factors that might lead to a case of infertility?
So medical factors, I think Dr. Misango has also touched on some of them, but there are things from birth that we can check. So for undescended testes, I like to speak about it because sometimes I find patients never knew, and I think it's just the worst because it can be corrected. If you have undescended testes and it is corrected by the age of 1, usually we like one, he's a urologist, so he'll tell us 1 to 2, we will get pregnant later in life. But a lot of people, it was never detected, and then maybe in the adolescence, then I find, oops, I have either one undescended testis or both of them are not there, and then that's when a surgical correction is done. And at that point, unfortunately, with the testis being in the abdomen, it has been overheated because heat is production of sperm in the testis, and there's no reverse. So such a man more likely will have something we call azoospermia, which is no sperm production, and therefore he would be in the infertile range of inability to ever get his own genetic child. So I think that's a very painful one because it can be corrected.
That's true.
There are other ones where it's a genetic factor, and he was never ever born with the function of actually producing sperm in the testis, and unfortunately for that, there's nothing that we can do about it. There are conditions like mumps and other illnesses, febrile illnesses that can affect in adolescence, especially in the growth period where the sperm is, the testis is really working, and in the adolescent period, if you get mumps or some febrile illness at that point, it can also affect your testicles, to cause you to have no sperma. So that's an important thing to note. So there are other conditions such as sexually transmitted diseases, and I think this is also important. And gonorrhea might do to a woman, block the tubes, can also happen in the man. So they would block the tubes of the man, the vas deferens, which are where the sperm are transported out into the ejaculate stage. So you'd find that you did have the ability to you actually have sperm and it's being produced, but it's not flowing out because the tubes are blocked.
As well.
And that is sometimes a function of just those STIs and STDs. So it's important to have, if you're having sex with, unprotected sex with some other partners, it's really important,
to just make sure that you're okay. All right. There's a question on masturbation.
Yes.
Does it cause infertility?
This subject is key to my heart. Let me tell you why. Because I have found, and unfortunately, a lot of men who got into the habit younger, who then have this notion of how sexual intercourse happens and are not able then to have an erection and an ejaculation with their wife.
All right.
And this is sad. Because it is the habit, if it is continued, if it is prolonged, if it becomes psychological that only when you're watching these things are you able to actually get an erection and have an ejaculation, then, and it is happening, unfortunately.
It really is,
that people are not able to have an erection with your partner, but when you're on your own, you are able to do everything. And so it is seen, as much as we want to say. It helps us in our medical line because it's for procreation. But apart from that, I mean, it is not right.
It is not right. Yes.
I can add something. Excuse me. Now, you see, I at some point I think I mentioned about a man being a seed producer. These seeds have to come out in one or another. Now, most boys will relate, or even most men will relate that when they were boys, at some point they masturbated. It is something which is most boys are made to feel ashamed about because it's supposed to be bad behavior. But these seeds have to come out. And there are three ways that these seeds can come out: by masturbation, by having a wet dream, or by having sexual intercourse. Now, in days when communities used to have early marriages, I don't think there was a problem with that so much because masturbation was a stage because these things have to continue in their lifetime. But we find men who are 30 years, 35, who are not yet married. It's a taboo for them to have what is called non-committed sexual relationships. But these things have to come out. Because if they don't come out, then they have other problems that are going to come. to a certain extent, these people have to masturbate. Does it cause infertility? No. But it causes it indirectly because they now get what is called, what doctors say, erectile dysfunction.
Okay.
Because the body is just like water. It picks the easiest pathway. If a man has gotten his body used to masturbation as a way of getting the seeds out, then the body adjusts that way because that's the easy way. Having normal sexual relationship with a woman becomes the hard way because she can either say yes or no. Okay. So it becomes now the default setting that you can only ejaculate when he masturbates. And that is the danger of frequent ejaculation, which is prolonged. Does it produce seeds? Yes. But now those seeds go to the wrong place, not into the woman. And that is one of the commonest causes of erectile dysfunction. But remember earlier on I said erectile dysfunction is not the same as infertility. But erectile dysfunction can cause infertility, because those seeds are not being put into the right garden. Okay. Can it be corrected? Yes. There's a lot of psychotherapy. There's a lot of couple counseling. And these days, unfortunately, we have some medications which can be employed to try and, I call it rebooting the system back to the default settings that were there before they were disrupted. On top of the conditions that Dr. talked about in undescended testes that can be corrected, we also have things that some men might have where you have abnormal veins in the testes. Abnormal veins because everything depends on active blood supply. So if the veins are abnormal, a condition called varicocele, which might not be diagnosed by anybody unless they now come for fertility tests, or if they came for some routine testing and then during examination it is found. These are known to cause problems with sperm development and maturity, and when we do surgery we correct them. But a lot of boys and men will be so hesitant to have any surgery when they don't feel bad. They only want to have surgery if at all there's pain, or there's something and they suspect maybe there's cancer and they want it corrected. But they don't realize that this is a condition that will actually cause infertility later on in their lives if not corrected.
All right. Let's take a break. But of course, when we come back, we'd also want to understand, so fine, most of the time, no sign, right? So then what is the diagnosis process for, look like, especially for the men? And then are there treatment options? You know, as far as infertility in men, are there some cases that can be reversed, others no, cannot be reversed? And then what do you do about the same? But of course, keep tweeting at NTV Kenya at Lubembe_Winnie on the question that we asked you, and that is, how often do you go for fertility checks? And of course, I'll be sampling them after the break. But before we go on a break, very quickly, on a campaign that you should be part of, and Kenya, what if we told you that your smile can help those next to you? Well, Colgate is helping to provide that, and especially when it comes to our children, if we can have that. So clean drinking water so that our children can again have a bright future by staying in school. So for every pack of Colgate that you buy at your nearest Naivas store over the next 2 months, you are helping to build 30 water wells that will provide clean water for 120,000 people. Now, that is something to smile about. So visit the Colgate Kenya Facebook page or visit the website that is on wellboring/colgate.com for more information. Terms and conditions apply. Stay blessed. We're back after the short break.
Malaria ni ugonjwa hatari sana unaoua watu wengi hapa Kenya. Japo kuko na corona, hatari ya malaria bado iko. Mtoto huyu alikuwa na joto jingi, kutetemeka, kuumwa na viungo na uchovu. Alikimbizwa hospitali ya umma ambako sheria za COVID-19 huzingatiwa na ni salama kwa shughuli ya upimaji. Vipimo vilionyesha kuwa ana malaria, na papo hapo daktari akampa dawa za malaria na kumshauri azimalize, na ili kujikinga wawe wakilala ndani ya neti iliyotibiwa. Malaria husambazwa na mbu. Walio hatarini ni watoto wa chini ya miaka 5 na akina mama wajawazito. Kupimwa na kutibiwa ni bure katika hospitali zote za umma. Usisahau adui malaria. Zero malaria huanza na mimi. Chukua jukumu leo. Komesha malaria. Ujumbe huu umeletwa kwenu na Wizara ya Afya.
Choose boldness. Celebrate the skin you're in and dress with confidence with Nivea Nourishing Cocoa Body Lotion. The triple-layered care of deep moisture serum, precious cocoa butter, and vitamin E enriches your skin for 48 hours. Choose to wear your skin with pride with Nivea.
Panadol Baby and Infant starts to work on fever in just 15 minutes. Trust Panadol Baby and Infant to work on fever fast to bring back their cute smiles.
NMG on NTV are now allowed to screen the 14 events from all over the world.
Nation Media Group will air this year's event in the year when the World Rally Championship celebrates its 50th season.
Kenyans, please tune on to NTV as we bring you the most exciting event on the rally calendar this year.
You're watching Your World in association with Colgate.
Alrighty, welcome back. Glad you're still with us. The show is Your World, and just in case you're tuning in right now, today our focus is on infertility in males, and of course the conversation still continues even during the break. So the question that I asked you today is for the men. How for fertility checks? Let's get to hear what you had to say. So Eric Mumba says, I believe it's a good idea, but trust me, no man will ever wish to go for the checkup. What if I find myself infertile? Okay, all right. And then Pavina Choki says, where is it even done? Which hospital? Okay, good question, good question. Hasso Ibra says, I have never done, but I believe Nikosawa. 5 kids, so alhamdulillah, I don't see the reason to go for one. All right. And then YBN Milu says, is infertility reversible? Okay, Dr. Ndego, how about we start there? Is it reversible?
Well, what we've discussed with Daktari obviously is that infertility is an absolute in terms of if I have no sperm and it's complete, like we wouldn't even be able to extract it from the testis, then unfortunately, yes, we would call you infertile because you are not able to produce seed and have a child. Okay. But there are other ways of having children that do not mean that it's not the only way.
Yeah, it's not the end of the
there's
road.
Donor conceptions and there's adoption, so it doesn't have to end there.
Yeah, absolutely. And then another one asked, where is it done? Which hospital? Dr. Misango, do you want to take that very quickly?
Basic fertility testing in a man is very simple. It just involves getting a sample of the sperms, which is done, as I think Francis said, you have to masturbate to basically give us a sample to be able to test. That's in a routine way.
All right.
It does not identify all the causes of infertility in a man, but it basically identifies over 70% of the causes of infertility in a man.
Yeah.
There will be other causes of infertility in a man, including hormone issues, and some of them would be problems maybe which somebody has been born with, or problems that developed over development. So we say common things occur more commonly. So the basic thing that we'll do, when a person comes for a fertility check, we will take them through a consultation, a one-on-one, to understand how their lifestyle has been, whether they've had any diseases in their lives, how it could affect them. Then we will be able to also find out about their medication history, what they've been taking, if they've had injuries, and then we will examine. An examination entails looking at how somebody has developed, because a man is expected to have some particular features that make us know he has a normal hormone distribution. So in terms of his facial hairs, in terms of how he talks, in terms of how his body hair is distributed, how the penis looks, how the testis looks and feels. So we get a very good indication just by talking and examining whether somebody is able to conceive or not. And then now we do the tests. Sperm, what you call semen analysis, looking at the quality, the number of the sperms. We also do some hormone assessment as a routine. And if we suspect there could be some other medical conditions or surgical conditions, we might do a scan or some other tests on his diabetes levels. And so these are things that are
it's a very
informed
comprehensive test, yeah?
Sorry?
It's very comprehensive, given
Yes,
what
these
you're
are things
saying.
that we see at that consultation. So it doesn't mean every man who comes for fertility checkup will go through this routinely. It is all based on what it is we see at that time. Yes.
All right. And before we talk about then the treatment options, and again, what usually happens when you find out that someone, again, either struggles with one thing or the other, what happens, what the treatment options look like? We talked about an aspect of surgery, and you know, that is how it feels a bit painful, but again, form of treatment, right? Let me speak to David. So David, you came to Nairobi and sought treatment. So what sort of treatments were you given or were you put on, and for how long were you on treatment? David, I don't know if you can hear me.
Kuna dawa nilipatiwa pale. Hello.
Yes, tunakusikia.
Kuna dawa nilipatiwa pale, but kitu alinsist ni kutumia hizo mavitu, then wakaniambia nikuwa natumia fruit mara moja. Hello.
Yes.
Nikaambiwa nilikuwa natumia fruit mara moja. Na niachize mafuta zingine nilikuwa natumia. So hiyo ndio kitu nafanya hadi sasa.
Okay. So mpaka saizi bado unatumia hizo dawa, and you still again observing your diet, you know, just to make sure. So for how long utatumia hizi dawa, for how long?
Nilitumia kidogo. Nilitumia kidogo then nikaisha hivyo. But kitu walikuwa wananiambia mara mingi nitumie food, hiyo ndio kwa wananiambia. And niachize niachize drug. Jupita kwa hiyo kidogo.
Okay. So ulimaliza dawa lini? Ulimaliza kutumia hizo dawa lini?
Imeenda kama miezi ndapita kitambo. Kitambo nimaliza.
Okay.
Can't remember very well.
Okay, it's fine. So uliambiwa ukishamaliza madawa ungoje muda gani kabla sasa ujaribu tena, ama uende urudi hospitali ukaangaliwe tena uambiwe kama umesaidika ama hapana?
Niliambiwa ni muda fulani, then they contact me. Hello?
Yes.
And then watacontact mwenye alikuwa ananishughulikia. Then yaniambie, because kuna mtu alikuwa ananishughulikia.
Okay. So kwa hivyo hujarudi bado?
Huyo ndio alikuwa ananishughulikia. Unajua ndio hapo information more kuliko mimi.
Okay. So kwa hivyo hujarudi bado kwa daktari kuangaliwa after umemaliza dawa?
Bado.
Okay. All right. Sawa. And then for Francis, if you can hear me, like you said, 5 years on treatment. How has been the process for you? What is happening right now? How are you? Francis, are you there? Francis, if you can hear me, I'd like to hear from you as far as the 5 years of treatment. Are you still with us? Okay, all right. So David is still on medication, but very quickly, Dr. we mentioned an aspect of abnormality, you know, when it comes to the sperm. So someone might be watching. What does that look like? You know, and when it comes to an abnormality, and then we'll jump straight into the treatment options for several people.
Okay. I applaud David. I mean, I think it's a difficult diagnosis, and he's still on treatment, so we wish him well. Yeah. But I do want to say that sperm parameters, it's very important to go to a proper specialist to get a diagnosis. And the thing about a semen analysis, to be honest, is one of the most important for us in fertility tests that we need to do, because it will actually tell us exactly what we need to do, as long as we've also examined the woman and have her corresponding issues or non-issues. Okay. So when we look at a semen analysis, we have to, one, check the numbers. So as we said, 40 is the cutoff in terms of numbers. Okay. But we have to think, what is the absolute cutoff? If you have 100 million sperm, are you going to conceive naturally? No. No. Yeah? Okay. So there are different treatment options depending on, one, just the number of sperm. So if we say we got, for our practice, it's 15 million. If you have above 15 million, then we're able to do something called an intrauterine insemination, which basically the man gives us a sample. At the time of ovulation, we're able to insert into the woman's uterus and reduce the distance the sperm have to travel. Oh, yes. Okay. And therefore the numbers will reach, the less numbers will be able to reach. All right. So that's the cutoff. But there are also, in terms of the way the sperm look. So that's another very important factor. The sperm, we've all seen the diagram. It has a head, it has a mid-piece, and it has a tail. It has to look normal. There's sperms that have two heads. There's sperms that don't have a tail. There's sperms that have a very small mid-piece. There are all sorts of abnormalities. There's sperms that have a pin head, looks like a pin, so the head is not proper. So those are abnormalities we look at and also think, okay, what's the percentage of sperm that look normal? If it's below 4%, it doesn't mean that you can't conceive, but you probably need more intensive treatments like an IVF cycle with ICSI, where we're able to take one sperm that looks normal morphologically and inject it into the egg. Okay. And then there's the aspect of motility. How are they swimming? So there are sperm that will not be swimming at all, and then we suspect, is there a problem in terms of even the quality? Or is it that 30% are swimming? 32% swimming normal is the natural number that should be swimming. So if we find that the sperm probably only 5% are swimming properly, then we may advise for an IVF cycle. But if we have maybe 15% or 20%, we may advise then for an IUI. So there are different things that we can do. Okay. I will just touch on David's point about taking medicine. Even that medication really depends on what parameters you get. If the sperm are very few, 2 million sperm, and 15, very few are moving and they look abnormal, to be honest, the medicine won't help. And this is something that I've seen over and over again. People told to take antioxidants, because what he is taking is antioxidant medication, which is what is in our fruits and everything. So we're trying to go against the toxins that he took in smoking. He also has to stop smoking, and that's another requirement. If he wants to get better, smoking, he has to cut off the toxins completely. If he takes the medicine and continues, there's no improvement that is going to happen. So this is something, but I think proper care must be taken, because I've also seen where somebody has been given supplements for 2 years and nothing is happening. So it's not about supplements. There's in-depth assessment that needs to be done on the semen analysis. Someone asked where it's done. We usually do it at Footsteps to Fertility. We do the full assessment for fertility. So it's, and I'm not, and any other fertility center can do it. But it's important to get a proper assessment.
Semen analysis, you know, and just proper assessment. Just make sure that everything is okay. Okay, can we address the surgery part, Dr. Misango?
Yes. Before I talk about the surgery part, I'll just mention something that Dr. mentioned, Dr. Anjiru. You know, for the sperms to be produced and to become mature, it's a cycle that takes about 3 months. And for most of the patients that I deal with, I would like to say, if at all you are looking at improving the quality of the sperms, one thing, of course, is you want to improve the blood flow, you want to eliminate the diseases that are causing a problem, and you want to detoxify. Now, the detoxification process is what basically most people use diets or supplements. If in 3 months you're not seeing anything significant, it's not going to happen. But you see, a lot of patients do not want to explore the other alternatives that are there, either due to fear of going to another person, or the fear of the expenses involved, or just that aspect of feeling insufficient. So they want to say, okay, daktari, wacha tuendelee tuone vile itakuwa.
Okay.
And they go on. You see, it's a belief, because nobody wants to believe. People want to feel like they are going to do this naturally. And it's very difficult to remove that. I'm sure daktari goes through that a lot. So as she says, it's not necessary to go through these things. 6 months down the line, you're still on supplements, supplementation, detoxification. 1 year later. It's good for your healthy lifestyle, because it's not just the sperms you're looking at, but your body.
Your health
We say
as well. Yeah.
the sperms are part of the very delicate living tissue that you have. So if you're seeing a problem with the sperms, there's something wrong also with the other parts of your body. So yes, it is a healthy lifestyle that you are living, but in terms of fertility, it's really not going to improve until you seek now the artificial method which he talks about, or the adoption which is there.
Right.
Now, coming to the surgical aspect of management of infertility, yes, it is there, because we said undescended testes, a baby who is born with testes which are not in the place where they're supposed to be, which is not a very rare occurrence, but when the testes remain, then that environment is not conducive to good sperm development. So we want to make sure that it's come down at least within the first 1 or 2 years of life. The longer it stays inside, the more it interferes with the fertility aspect. But we still get it down, and it improves. It does not mean 100% somebody will be able to conceive, because there are some of the factors that make the sperm not come down that are inherent in the person. So they will also interfere with their future. So, but it means we correct it to improve the chances of fertility. So that is surgical.
Okay.
Number 2, if somebody has had an injury of whatever reason in the testes, then it interferes with the function of the testes, and you can do surgery to remove the blood which has collected there to basically be able to improve the function of the testes. Number 3, if there's an abnormal veins, which are called varicocele, that we detect during the routine examination of somebody coming for fertility testing, then we're able to do surgery to remove those, to block those abnormal veins, because the abnormal veins interfere with the normal drainage of the testes. So that blood is now going through abnormal channels and not washing away the toxin that we're supposed to be. So we block them, and remove the abnormal veins. Number 4, things like cancers. Okay, if you have cancer in the testes, it will interfere with the function of the testes. And we know, even if the cancer is on one side, if we remove that side, if we remove the cancer on that side, the remaining testes will continue working normally, hopefully, if at all it has not been interfered with by medications that have been used to treat the cancer. So there are very many things which are available surgically, and some which are available medically to try and manage. But the cornerstone of management of anybody with infertility is improving the lifestyle by improving the blood flow and reducing the toxins by detoxifying. And that is for somebody to conceive naturally or even unnaturally, because you want to improve the quality of whatever is being produced so that it can be harvested to be deposited for it to conceive.
Absolutely. Yes. Okay, let me speak to Francis and David very quickly as we take your parting shot as far as, and Francis, let me start with you very quickly. Having gone through treatment for 5 years now, how are you? What would you say to all the men watching us today?
Sorry, I didn't have the last part of the question.
My question is, how are you after 5 years of treatment? Are you still on treatment? Are you okay now? And what would you say to all the men watching us today?
Okay. After 5 years, we were able to conceive, and we got a baby boy, and then after that we got another 3.
Yes.
So now I'm a father of 4.
Congratulations.
It was, but I think either way, when you're going through this fertility process, just to all the men, there is a lot of emotional, financial strain, and the fact that the lady usually gets the brunt of you know that she's infertile, or you know not able to conceive. She gets a lot of that. But when you have to go through the process of elimination, as a man, you have to step up and get yourself tested. Either to eliminate that possibility that you are part of the situation you're in, or and get treatment, and then you can continue supporting your spouse as you go through the journey.
I like that. Thank you very much, Francis, and congratulations to you. Now, David, very quickly to you, having gone through, you know, this journey, you're still on medication, and we say all the very, very best to you. But what would you say to all the men watching us and thinking, hey, do I really want to go through this process as far as treatment is concerned? What would you tell them very quickly?
Hello?
Hello, David?
No, the question is not clear.
I'm saying, after going through, you know, the treatment process, and maybe someone is watching us and anafikiria, ai mimi sijui yaki kama naweza, right, to go through this process, unaweza waambia aje?
Mimi tunaweza show wase kama anaweza enda muda mrefu pia, wane kama kuna mambo yengi poa, anaweza tafuta kusaidizi.
Okay. All right. Sawa. Thank you very much, David. Thank you very much, for Francis, for just speaking to us this morning. We really, really applaud you for just speaking to us, you know, as far as what exactly is happening and, you know, the different journeys that you had to go through. So, David, all the very best, you know, in your treatment. And then let me come back to you, Dr. Misango, and then I'll finish with Dr. Anjuru as far as just cost. Because I think Francis mentioned this, and then someone else during the feedback said, again, in as much as someone would want to go through this process, either for testing, analysis, you know, assessment, all those things, but there's usually an aspect of cost, you know, which is required.
Yes, the initial assessment is not that expensive for a man, because it's basically more dependent on the man stepping up to accept to have that test done. That actually, I think, is the most critical aspect of a man's fertility testing. Because you come to the consultation or our center, and we ask you to give us a specimen of your semen. It has to be brought into the lab within usually 45 minutes of having been produced. So the option of going to produce it at home
and then come
and bring it back is not really so much there.
Yes.
So that's why some men get a bit stressed by that. There are people who suggested how it can be done, but neither here nor there. That test is not expensive. Most places it will cost between 1,000 and 5,000 shillings, okay, to have that semen analysis done. The other tests, which will be the hormone tests that are not mandatory for everybody, but depending on the person's fertility testing, will cost maybe something between 10,000 and 20,000, the hormones. Then, that is the testing in a man. The treatment might be a bit more expensive depending on what it entails. Because if at all it is surgery, then that depends on the level of the hospital that somebody has to go to and what they're comfortable with. But they are mostly what I consider fairly mild to moderate surgeries that we do. The medical treatment depends on if at all it's hormone manipulation, because the man has some hormonal imbalance. They can go for some time, but I said it is futile to extend this for a long period of time if the objective is just to have conception.
Okay.
In terms of other aspect of a man's, it's okay, one man's well-being, the treatment can continue for life because hormones are what you require to maintain your normal your normal status as a man.
Okay.
So this will be a lifelong treatment with frequent assessment of the hormones to see how they are. Now, when it comes to the methods of now artificial insemination, now I'm sure Dr. can tell us more about that and the cost involved because now this is one of the things that basically put off a lot of people. But I know even as late as last night, one of my clients was asking me about that option. So it's a good time to talk about it.
Yes, and of course, there's also very quickly, Dr. Ndegwa, as the question of sperm freezing, because we usually hear more on the egg, right? Where you can freeze your eggs, and then when you're ready, you can always, conceive. But sperm freezing, can you talk about it very quickly, like maybe a minute?
I know, and I think it's an important thing to talk about, Winnie, and I'm glad you brought it up because when he talked about patients with testicular cancer or other cancers, and the chemotherapy and radiation affecting sperm, which they do, it's important for who has not conceived or wants to conceive later in life after, and who has been diagnosed with a cancer, and especially a cancer where the chemotherapy or radiotherapy will affect, which is something you should ask your oncologist. To know that you can actually freeze your sperm and be able to have a child later on in case the gonads are affected or the testicles will be affected. So this is available option. I am seeing a bit more of that happening right now. Some oncology centers are actually referring men so that we can freeze their sperm, which is really good because it gives you the chance later on. Cost-wise, IUI or the intrauterine inseminations, anything between 30 to 70,000, so it's not very expensive. And an IVF cycle costs anything between 400 to 600,000. Expensive, but it is all in the context of what you really need
at the end of the day. All right, Dr. Wanjiru Ndegwa Njuguna, fertility specialist, Dr. Samson Misango, urologist, and of course, we were joined by David and Francis on phone. We say thank you. Thank you very much for coming by today. Very insightful conversation that we had, and I hope that you've learned a lot and know all the options and what you need to do. But at the end of the day, let's just fight together so that we end stigma as far as infertility is concerned. So we have to end it here. My name is Winnie Lubembe. On behalf of everybody who put together the show, we say thank you. But quickly before we finish, we need to remind you about an ongoing campaign where when a child has to help their family fetch water, there's no such thing as a day off. So you can help us change that, and Colgate is asking all of you to help support the future of our country, and that is our children, by purchasing a pack of Colgate, where of course you'll be helping more than 120,000 families in the country. So that is where we say goodbye and have yourselves a lovely day ahead. I'll see you tomorrow morning, same time, same place, right here on Your World. But until then, take care. Goodbye.